So Heather Hauck is here. She's the director of Maryland's Infectious Disease and Environmental Health Agency. She is a fantastic partner to the University of Maryland, and she's an incredible leader. Please join me in welcoming Heather Hauck.
Good afternoon, everyone. I know it's after lunch. Try that again. Good afternoon, everyone. Great, thank you. I am very pleased to be here this afternoon at such an inspiring and visionary event. It is incredible to look out into this room and see the faces that are here, including many community partners. I just saw Carolyn Massey walk in the room, so we are among friends and among an opportunity that I think is historic to have this conversation today. So I bring you greetings on behalf of Secretary Sharfstein and Deputy Secretary Fran Phillips within the Department of Health and Mental Hygiene. I know that this is going to be a day full of enlightening discussions as we as a group and as a community move forward in achieving the goals that are set forward in the National HIV/AIDS Strategy. And my goal this afternoon is really to outline the National HIV/AIDS Strategy and interweave a couple of comments around where we are today in the state of Maryland and how you and the work that you're doing through the Preparing the Future initiative can help us move. So first and foremost, I of course want to extend the department's appreciation to President Perman and all the deans of all of the schools who are represented here today. It is really an amazing commitment to unite this campus in an effort to get to zero as one university. I also would like to thank the leadership at the Institute of Human Virology for your ongoing pursuit of the science that drives the work that's being done to end this epidemic. And certainly to the dedicated leaders like Derek and like Jamie and the many others at the JOCS Initiative and the University of Maryland for your hard work organizing this tremendous, momentous event. As I prepared these remarks, I learned quite a bit about why this initiative is so appropriate at this time for this school. So for those of you who may know about your school but not the others, let me tell you for 2 seconds what I learned. I learned that the School of Medicine is America's oldest public medical school and is ranked 7th among all 76 public medical schools and is one of the fastest growing research enterprises in the country. I learned that the School of Dentistry was the world's first dental college, first in the entire world. I learned that the School of Law is the 3rd oldest law school in the nation. I learned that the School of Nursing is the largest nursing school in Maryland and one of the largest in the country. And I learned that the School of Social Work is one of the largest and most respected schools of social work in the nation. And last but not least, that the University School of Pharmacy is the 4th oldest pharmacy school in the nation. If you listen to that litany of history, it's an incredible foundation, and it's really appropriate that as the founding campus of the University of Maryland, each of the schools that are represented here in this room are a part of that rich history that lays the foundation for the future of opportunities. And now's the time, I think, to do that again around the issue of HIV. A future where there are 0 new HIV infections, 0 AIDS-related deaths, and 0 stigma associated with HIV. I'm also particularly excited to be here today because we're living at a unique time of potential, both here in the country and here in Maryland. Why? We have the science behind much of what we've been talking about. The science has finally shown us that people who are tested, diagnosed early, and are virally suppressed actually transmit HIV less frequently. So we really have the science behind what we've known for a while. We've got better data than ever to really help us hone in on where the epidemic is and what populations we need to be looking at. And we have policy, healthcare reform, other policy initiatives that have really converged in a way that has people talking about ending the HIV epidemic. It's fairly amazing in the history of this country to be uttering the words ending the HIV epidemic. But what we have to have, and what I view as sort of the secret ingredients to bring to the science and the data and the policy, are really you all sitting out there. You have to have the will, you have to have the resources, but more importantly, you have to have the boots on the ground, the people who are doing the work out in the community in order to make that a reality. And that's you. As I look around the room, and especially in the front row, no offense to my colleagues, many of us have more gray hair than we had when we first entered this epidemic. And so as I look out in the room and note the variety of folks who are here in this room, I think it's really indicative for us to be talking about the role that you all play as emerging professionals in achieving this goal. So as I said, my task today is to walk you through the National HIV/AIDS Strategy so that as you move into the breakout, here we go. As we move into the breakout sessions, you have a clear sense of the foundation for the work that you're going to be doing in those sessions and here at the university and here in Maryland to get to zero. Derek has already given you the framework for why this conversation is important. We're second in the country among states and territories for our AIDS case rate, and the Baltimore-Towson area is fourth in the country for our AIDS case rate. So we know that there's a lot of work to be done. The other part of my task today, I think, and one of the reasons I was asked to be here, is I have an opportunity to underscore the importance of an interdisciplinary approach to achieving these goals. As you may have noted in the program, I am a social worker. And while I now work at the policy level, I worked for many years at Washington Hospital Center in Washington, D.C. as the inpatient HIV social worker. At that time in the epidemic, I saw over 500 people in the hospital setting a year. And we had an outpatient clinic that grew while I was there from 200 individuals living with HIV to 700 individuals living with HIV. And I share that about my background because I think it provides you with a sense that I have a perspective of not only a policy systems level perspective, but as a clinical provider, a direct service provider, I know that it takes every single person in this room at all levels, bringing your skills and abilities together to improve health outcomes for the individual as well as for the community. HIV intersects every one of your programs, and therefore you have an opportunity in each of your disciplines to make a difference in this epidemic. So, the National HIV/AIDS Strategy. I'm going to read to you the vision of the National HIV Strategy because I think it's probably one of the more powerful statements that has been written in our country's history. So the vision statement for the NHAS, as we affectionately call it, the NHAS, the United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care free from stigma and discrimination. It's an amazing vision statement for the work that needs to be done. And very social worky, I might add. Quite pleased with that. So there's a whole bunch of federal agencies and players that are working in D.C. and across the country in achieving this vision. But I think the most important thing to remember is that achieving the vision will only be accomplished by those of you who have the boots on the ground in the jurisdictions, and especially in jurisdictions like Baltimore, where we have such a significant disease burden. And those folks are you. So as you can see on the slide, there are three primary goals of the National HIV/AIDS Strategy: reducing HIV incidence, increasing access to care, and optimizing health outcomes, and reducing HIV-related health disparities. I will note there is a fourth goal, and that fourth goal is actually to increase coordination among federal agencies. I spend a lot of my time going to DC and talking to those federal agencies about what they need to be doing to achieve that goal, and it's a whole nother lecture in and of itself what the federal agencies need to be doing. So we won't discuss that one today because it's not necessarily relevant for the topic at hand. So what I'm going to do is I'm going to very quickly talk about the targets for each of these goals, and then I'll talk a little bit, within those targets, I'll talk a little bit about what needs to be done and where you fit in. So first and foremost, the first goal, reducing HIV incidence. So let me give you a perspective about what that means here in the state of Maryland and here in Baltimore. So in the state of Maryland in 2010, we had about 1,430 new cases of HIV. So if we were going to reduce the number of new infections by 25%, which is what this goal speaks to, we would actually need to reduce the number of new infections by 367 new infections. And here in Baltimore City, we had about 406 new HIV infections in 2010. So we would need to drop that by 101 new cases of HIV. Now, those of you who work in the field know that one of the only ways you can actually reduce incidence is by testing people so that they know their status and then can change behavior so that they don't transmit to other individuals. So in order to achieve a reduction in incidence, we actually need to increase testing, perhaps find more cases so that we can then reduce incidence. And those numbers in terms of reductions do actually sound somewhat doable. You know, I think we could reduce the number of new infections by 101 in Baltimore City over time. But you also have to remember that these numbers have been fairly consistent for years, despite resources invested, despite creativity and how that testing and how those reductions are achieved, and real focus on achieving those. And number two, the other thing to keep in mind is that most of these cases are in populations that are highly impacted by social determinants of health. So folks who are living in poverty, folks who have substance abuse or mental health issues, folks who are experiencing stigma. And so we really need to also be sure that we're comprehensively addressing social determinants of health so that we can achieve a reduction in HIV cases. There are two other targets associated with these goals, or with this particular goal. The second target is reduce the HIV transmission rate, which is a measure of annual transmissions in relation to the number of people living with HIV, by 30%. And the other third and last goal for this target for this goal is increase from 79% to 90% the percentage of people living with HIV who know their serostatus. That again speaks to the importance of testing and why many of the Preparing for the Future initiatives where you all are out in sites like Paul's Place and doing testing. I noticed on one of the posters 230 tests that were done, 234 tests that were done at Paul's Place through this initiative contributes significantly to this effort. The nice thing about the National HIV Strategy Goal is it didn't only lay out goals and then targets, it actually then laid out some steps. It's important to have a roadmap for how you're going to get to achieve these targets. So for this particular goal around reducing HIV incidence, there were three main steps. And the first is to ensure prevention efforts and resources are concentrated in communities with the highest prevalence. So your campus sits in one of those areas. If you look at the zip code and the surrounding zip codes of where this campus sits, 1 out of every 21 people in this zip code are living with HIV. And in Baltimore, 1 out of every 41 people are living with HIV in our city. So focusing this campus on HIV care and prevention will make a difference for the city. Step 2, use a combination of approaches to expand targeted efforts in HIV prevention. That's why interdisciplinary work is so important. There is stigma reduction work that needs to be done. There's community engagement work that needs to be done. There's medical care that needs to be provided. There's testing that needs to be done, legal issues and psychosocial interventions that need to occur, and you all are uniquely situated to deliver that comprehensive package and combined package for HIV prevention.